Hello, my name is Catherine Smith, and I'm a senior at the University of North Carolina at Greensboro. I've been a dental hygienist in Greensboro since the year 2000. And because of my background in dentistry, the position that I have chosen for this project is a public health dental hygienist in Sarasota County, Florida. One of the reasons that I've chosen this position is because, in my experience, I have strictly worked within private practice. Most of the patients that I've seen over the years have all had insurance. They also come to the dentist on a regular basis. They don't need a huge deal of intervention. They're fairly well maintained and have fairly healthy oral environments. According to the CDC, about 50% of the population don't go to the dentist on a regular basis. And that's the spectrum of population that I would like to use my skills to help educate, because these people are not getting the opportunity to learn how to take care of their mouth because they're not visiting the dentist. This position lists the job description as focusing on oral health education, and this is done by the public health hygienist being a liaison between the Sarasota County school system, families of students, and the public health dental clinic. Um, the public health hygienist also performs clinical duties such as prophylaxis, which are the cleanings, actually taking x-rays and doing scaling and root planing procedures, which is done on people who have advanced periodontal disease. The position requires a little bit of travel, so the public health hygienist is actually traveling to different schools around the county. The hygienist would also be required to travel to different committee meetings and also lead committee meetings, which are organized to help implement different school-based programs, such as the sealant program, which is a current program that the Sarasota County school system is using. And this is where children have the opportunity to have sealants placed which prevent cavities, especially if they're not able to get to a dentist in a private practice setting and have this procedure done. Basically, the public health hygienist in this position would be promoting and establishing population-based dental preventative services and educational programs that relate to dental health on a public health basis. It's a mix of clinical skills and communication skills. Some of the qualifications that are required for this position is that the applicant have a current and valid dental hygiene license in the state of Florida. Now, if somebody doesn't have that license currently, they could go through a process of obtaining this by applying to the Florida State Board of Dental Examiners and sitting for a written exam that will test for dental aptitude. The applicant would also need to actually clean a patient's teeth and have that evaluated, all this before they're actually licensed in that state. The applicant would also need to be able to efficiently manage their time because of all the duties that are involved within the job description. Communication skills are an important qualification of the applicant. Also, organizational skills, organizing patient records and consent forms and treatment authorization records. And a lot of this is done through computers now, and so the applicant would need to be proficient on computer and feel comfortable using computer-based dental software programs to help with those types of things. Um, I feel like I do have some skills and experience that fits with this job announcement and that puts me in a position where I'm qualified to maybe be a runner-up for this position. I've been in dentistry for 12 years and I've worked strictly in a clinical setting. And so when it comes to doing cleanings for patients, exams, x-rays, those types of things, placing sealants for children, I've done that and have plenty of experience in that department. I've used dental programming on computers for organizing patient charting, patient notations, even charges for most of my career. So I'm fairly comfortable using software and computer-based programs to help with those types of things. When it comes to time management, naturally I've had to work within a schedule, and so I do know how to delegate my time efficiently. I have to be organized and think ahead so that I'm able to complete the full spectrum of one task before moving on to the next. Um, every day with patients, I use communication skills. I use them to inform patients on their personal oral health status, as well as give them helpful advice on how to improve their home care, which in turn improves their overall health. I've been working long enough that I know what and how to say certain things to patients that I know it's going to get through to them, so that hopefully that facilitates a behavior change. For instance, if I can tell a patient has not been flossing because they have interproximal gingivitis, they've got inflammation between their teeth, and I talk to them about why it's important to floss and how to properly floss. Once they come back in 6 months, I have seen people that have improved, and so I know that certain things work when I'm communicating with patients, and so I do feel like I have established that skill, which is a qualification for this position. I've always worked in offices with several other employees, and so we've always had to work together to cohesively allow the office to function, and that requires lots of communication skills. That way, the office is run smoothly, patients receive proper care, and everyone stays on schedule. I've also attended local dental hygiene society meetings, so I'm fairly familiar with the process of collaborating with others. One thing I've not done is actually lead one of those meetings, and so that leads me into the skills that I need to obtain that I don't actually have when it comes to the public health hygiene position. I don't have a dental hygiene license in the state of Florida, and so going through those steps of obtaining that would be one thing that I would need to do. Um, I feel like I'm currently acquiring skills and information needed for a public health position within this field through my classes here at UNCG. However, shadowing a Guilford County public health hygienist may give me more insight into the day-to-day workings of this field and give me an edge, even though I don't possess the actual experience working within public health. Since computer knowledge is required and there are many different software applications on the market, I could call the Sarasota County Public Health Department and inquire about which programs they actually use. And if it's not one that I've used in the past, I might be able to research that on the internet and get a little more familiar with how that program actually works. I do have experience with communicating patients about their oral health on a one-to-one basis, but I don't have experience with public groups or group communication. And one way I might be able to acquire this skill is to volunteer to teach brushing and flossing at an elementary school. That way I'm learning how to get in front of a group of people and educate them rather than just that one-to-one basis that I currently possess. Overall, I would need a professional development plan to get myself to where I'm transitioning from the private clinical setting to that of the public health clinical dental hygiene setting. The population served among these two types of dental settings is different as night and day. Clinical settings sees a majority of people who visit the dentist on a regular basis, like I said before, who have insurance, who get their restorative work done when small signs of problems arise. A large portion of the population that don't have the means to visit a private dentist due to finances or a lack of insurance, or don't have the opportunity to be educated in a dental setting. This part of the population is not being reached with information on oral health and home care instructions, and this is the part of the population within the public health field. And so those are the differences between clinical private practice and public health hygiene. For this particular professional development plan pertaining to the job listing in Florida, I would need to acquire my license in that state once again, and I would also need to have a positive influence and provide a means of dental education for the parts of the community who may not have the opportunity to visit a dentist on a regular basis once again. Um, Overall, I am pretty excited about my transition, and I appreciate the opportunity to talk to you today a little bit about my experience and where I'm heading. And I thank you for tuning in, and have a great evening.